online platform at a later date. And then at the end, I'll just ask if everyone is happy to fill out a survey. So what are we going to cover today? We're going to start by discussing the general impact COVID-19 has had on mental health and wellbeing for children and young people across the UK. Then I'm going to look more at the data and the research that's already out there. I've got some information about the mental health services within the Midlands and Birmingham over the past few years, as well as some national statistics about the inequalities that exist for Black children and young people. We have got a few ways for you to get involved throughout the session, and we welcome any experiences, again, like I said, just join the conversation. And then we'll look at the research that I found, what the barriers are that could present for Black children and young people, and where we think we should be going next. And then finally, I'll be handing over to Kadra from Centre for Mental Health, who are a leading organisation in mental health policy change and building research evidence to create fairer mental health policy. And then we'll leave some time at the end for any questions, but if you've got some, just put them in the chat as we go along. So it's no surprise to say that the international research indicates that pandemics have had a really extremely negative impact on mental health, with children and young people being especially at risk due to their limited understanding of the event. COVID-19 has increased many risks facing children and young people associated with the disease, and the impacts of lockdown have also exacerbated this. It's led to an exceptional increase in anxiety and other mental health problems among children and young people, and there's been an accompanying decrease in their emotional well-being, as well as exposure to domestic violence and exposure to exploitation. The NSPCC saw a 32% increase in calls from lockdown. The closure of schools and limited access to friendship groups can exacerbate these risks and cause acute anxiety and stress in young people. And there's also the fact that they're spending all day indoors and that the only way they can really see their peers is through online platforms and smartphones. The frequent exposure to media coverage of the crisis just is another way to exacerbate mental distress and make it even worse. And the fact that COVID-19 just dominated headlines on all news outlets. It's important to highlight that Black children and young people were also exposed to distressing news coverage regarding excess deaths of Black people due to COVID-19, which could have potentially contributed to increased mental distress and COVID-19 related anxiety. So the results indicate that the longer the quarantine, the poorer the mental health outcomes, and then the longer those outcomes are likely to continue. And that's been found from research related to past pandemics like SARS and Ebola. So we can likely expect to see similar things going on with COVID, coming out of COVID now. So the findings indicate the significant impact on mental health of children and young people, and that there's a particular effect on the most deprived families and their children. Those of lower income families are more likely to show emotional difficulties, feeling unhappy, and experiencing physical symptoms than those of a higher level income family. The racial inequalities are exacerbated when we think about all the other social determinants, such as health deprivation, gender, and other biases that mental health provisions are subject to. It's highlighted that the gulf between pre-existing health conditions and poverty, and also the role that the schools and children's services had to play in society, that we noticed when COVID came into play. And it's also really important that whilst we were living through all this trauma of COVID-19 pandemic, and it was impacting on the whole children and young people as a whole population, the Black children and young people also had to process frequent traumatic images of Black people who have suffered racially motivated brutality and death. And during this time, it would have potentially enhanced the reality of the impact of racism and the societal limitations that this has caused on their own lives. And this could potentially lead to Black children and young people to suffer with vicarious trauma daily. So we'll keep that in the back of our minds, and we'll move on to the mental health in Birmingham. And Birmingham is the youngest city in Europe, and its current population of 1.1 million, we sit at about 28.5% are aged 0 to 19. And of this young population, 11.1% identify as Black Caribbean, Black African, or Black British. And then when we look into the mental health services available and the access to the services, the Midlands as a whole region does not meet the national ambition of 35% receiving support. And actually, this is the lowest region compared to every other region nationally. And the consequences of not supporting these children and young people with mental illness can be self-harm, substance misuse, suicidal ideation, and they can ultimately lead to having criminal justice involvement or poor physical health. And so Forward Thinking Birmingham, this is our community and inpatient help partnership. They work alongside partners to offer care pathways for all young people aged 0 to 25. And in 2016, they were commissioned for 12,000 referrals per year. And then they've seen an average of 10 to 15% increase in referrals on a yearly basis, which put them on track to over 25,000 referrals in 2022. COVID-19 may have increased the acuity of the symptoms presenting, but it also would have exacerbated inequalities such as poverty, as previously discussed on the other slide. And then another important fact to highlight about this issue is that the number of probable mental health conditions is on the rise in children and young people, with now an estimated 1 in 6 young people having a probable mental health disorder. This is up from 1 in 8 only 3 years ago and 1 in 10 in 2004, which puts it at about an average of maybe 5 children per classroom. So more specifically, looking at the Black children and young people population and their mental health, that even though there is additional risks of mental health conditions suggested by the fact that they've got exposure to racism and vicarious trauma, there was a recent large-scale community survey, and that showed that children and young people's mental health in England, that there was a lower prevalence of mental health conditions in the Black children and young people compared to the children and young people of a white background. So 14.9% of white children and young people, compared to 5.6% of those within the Black community, were reported to have a mental health condition. So you could suggest that this would be down to maybe more resilience within Black children and young people, but actually it's more likely that there's underreporting of mental health difficulties. And the reasons why, it's really not clear. There's no real obvious reasons that have been investigated, but we could just a few reasons that there could be fear of stigma, concerns of lack of cultural awareness, there could be lack of engagement with the service, or recognition of mental health disorders by the professionals within the service, which means they're not getting the treatment that they need. And then the lower community prevalence within mental health services is not consistent with the higher proportion of Black children and young people who are presenting in inpatient psychiatric services. So the overrepresentation of Black children and young people is much higher in inpatient services, and the reasons for this haven't been truly investigated, but it's been found that when they are presenting to mental health services, they need more prolonged services, they have more frequent contact, but they have shorter contact duration. But eventually, it actually means within a 12-month period, they're more likely to be re-referred into the service. And then some of the reasons for this could be that the research has shown that Black children and young people are more likely to be referred to the mental health services through school, social services, or youth justice services compared to white children and young people who are normally referred through their primary care pathway. And then the differences could possibly show that there's a gap in the early identification of mental health problems among Black children and young people in healthcare settings. So moving on, I feel like I've probably spoken a lot now about the mental health problems and the data available, but moving on to what the inequalities are, and thinking about why they exist. So just going to open it up to you. There's a Menti available. The code is on the slide. If everyone can feel free to join and just put in a few ideas about why we think the inequalities that we've discussed do exist. And then we'll move on to the Menti slide and see what we've got there. So Liz has just put the slide up, and really it's just what your thoughts are about why these inequalities exist, and then we'll think about moving on about how we can target them in a later slide. Thank you for your suggestions. Yeah, brilliant. Thank you for all your thoughts. Really clear there that one of the main themes is racism, and I've talked about it a lot throughout the talk already, and I will go on to mention about the stigma and access to services in the barriers that present. Brilliant. Thank you. Thank you for those ideas. So we will carry on with the oh, we've got a few more. Thank you. Yeah, we'll carry on with the presentation. There's a lot of things, and we could probably list a huge list of things which are creating inequalities for these young people as to why they're not getting the access and the treatment that they need. But from the research available, there is little known about the developmental differences in how the development of mental health problems in ethnic minorities develop through their age, especially at a whole population level. So in some research, it's been shown that children from other ethnic minorities follow different developmental trajectories of how they present with their mental health conditions, with their internalising and externalising of problems compared to those of white children, either in terms of how they present or the rate of change of their mental illness across the age. So these differences were not explained by the child's sex, their socioeconomic status, their maternal depressive symptoms, or maternal immigrant status, which highlights the fact that there's more research that needs to be done as to what the factors are that underpin the differences in their children's mental health. And moving on from that, the mental health professionals which we do have are predominantly of a white background, and they can lack confidence in the ability to detect the difference in the symptoms of, say, anxiety or depression of children of a non-white background. And there are a few Black clinical psychologists. And having the lack of diversity within the workforce means that many lack the knowledge relating to cultural communities, and this can negatively affect the quality of care and treatment outcomes. And then there's also the concern of stigma and concerns of lack of cultural awareness, which means they're less likely to engage voluntarily with the mental health services. Another important consideration is the difficulty in navigating the service and barriers to access, and thinking about poverty and how the service operates on a 9 to 5 basis, multiple appointments that require travel, which could incur costs to that young person, and then thinking about what the first language is of the young person and how they might access the service online, or if they have to self-refer, that can be a really daunting process. And then inequities continue to exist because there's currently no national requirement to address what the inequalities are, and then limited analytical uh, research into the inequities and how this can be fixed. So going back to Menti, and going to ask you how we think we should be addressing these inequalities. So it's the same Menti as you used before. The code is at the top. Just you can write a few words in this one. It's not the expanding word one. Your answers will come up all anonymous, and we'll really appreciate your suggestions. Thank you. Oh, Joe, thanks. Yeah, we can see your input in the chat there. Lack of co-production, yes, definitely. And it's really important to get the service user involved in creating those services to get them on board with the type of service, and then they're more likely to engage. So if anyone's got any suggestions of how else we can improve. Yeah, so just having a read now, and it's about policy being old, not changing, and lack of new ideas, and working with the young people to find out really what they want and what the local services are. And like that's important, gaining trust within the NHS and communities to make sure that they feel like they can use the services and get what they need out of them. Brilliant, understanding different perspectives and cultural awareness, and that will come into what I'm going to say about having real cultural awareness, cultural compassion about everything that we do. Yeah, providing literacy and making sure that we take the time to try and target all different communities, especially those marginalised at the moment. Great, brilliant. And then we got a couple more. Yeah, and that really comes into the racial trauma and racism, and helping Black children and young people really deal and express their past experiences as well. Thank you very much for all of those suggestions. We will carry on, and as I've alluded to, there is very little research available, especially on individual communities and individual populations. The UK government, Department of Education, have made lots of pledges, and there is lots of ways they're trying to improve mental health services across the nation. And there's more money being put into mental health services, but very, very little at the moment is about targeting the inequalities and inequities that already exist. And there is continued barriers and interventions, and we've highlighted a lot of them already. Very little evidence or research has been done about how we can really tackle these barriers and look into what the long-term impacts of COVID-19 are, especially on the mental health of children and young people. But in better news, there are things that are being done, and the research that has been done has been made some really good recommendations. And Bernardo's have recommended long-term change involving rebalance of the educational system so that mental health and well-being are on par with academic achievement. There should be like redesign in the mental health provision, and young people themselves should be working towards a continuum of care. So they've got the digital services and alternative therapies. And then didn't been discussed, but COVID-19 really highlighted that there was pre-existing health conditions, poverty, and the role that school and other children's services had in some sections of society. And it's been highlighted that the well-being of children and young people was not sufficiently dealt with before the pandemic. And then because of COVID, a lot of the mental health services, particularly community-based teams, have then heavily relied on phone, video consultation, and there's been a huge shift towards the digital platform. And then overall, it appears that there's been a positive transition to telepsychiatry. It's been viewed as like convenient and safe for patients. It's got a really good benefit of overcoming barriers like distance and cost and waiting times. And then it's also got perceived benefits for those children and young people who are concerned about their anonymity, privacy, emotional safety. And then they've got increased flexibility and control because they're on a platform that they're comfortable with, and accessibility to treatment. So it'd be really interesting to see how this is continued to be used after the pandemic. And then to improve the experience of Black children and young people and make them more likely to engage in the service, there needs to be a conscious effort in the way the services are designed, really engage them and be considerate with staff diversity, and use service users, ask them how they'd like the service to look, and then really consider the potential impact of racism and related trauma on the Black children and young people, and their mental health needs need to be considered in the diagnosis and treatment formulation, because their lived experiences need to be acknowledged, validated, and they need to be supported in being able to discuss their experiences and being able to create ways to manage them and give them strategies to manage what they've been through. And then really essential that staff are trained in equality and diversity, and that training is considered to be revised to consider the impact of racism on Black children and young people, and that cultural compassion needs to be considered in all our clinical practice. And then just at the end, there's a couple of things that are being done in Birmingham at the moment. The Patient and Carer Race Equality Framework is a pilot scheme that is being delivered in Birmingham Solihull Mental Health Services, and their target is to eliminate the unacceptable racial disparity seen in access, experience and outcomes. And they have got a launch event on the 3rd of November, which is free for people to attend. And through that, you'll be able to find out more about what they're planning on doing with that project. And then the Blachier within Birmingham City Council continues their great work, and that continues to identify health inequalities within health services. And then finally, my final slide before I hand over to Kadra is there is some excellent examples of all these programs, charities, organisations that promote mental health and wellbeing and try and identify the inequalities that already exist. You probably recognise a few of them there. There's Kooth, which is a platform to offer free confidential service for young people. And another service that's already in Birmingham is a partnership between Bernardo's, Our Place mentoring scheme, and Birmingham City University, which is part of the early help offer and offers sessions that aim to be inclusive and tailored to young persons' needs. I won't go into all of them, but we'll provide the site links and you can have a look at them in your own time for further information. But for now, I will hand you over to Kadra, who works for Centre for Mental Health, and there will be time for questions at the end. So thank you, and over to you.
Thank you, Abby. Just going to figure out how to share my screen. 1 second.
No worries. Lovely.
Yeah, you can see that.
Yeah, I think, yeah, it's come up as a presentation.
Brilliant. Thank you. Thank you, Abby, and thanks for inviting me here to speak today. Yeah, I'm really going to corroborate a lot of what you've said already, but just sharing some of our work around racial inequalities and young people's mental health, and specifically thinking about Black children and young people. So for those of you who aren't familiar with us, we're an independent national charity who conduct research to help bridge the gaps between policy research and practice. And we do our work through the lens of tackling inequalities in mental health, so racial inequalities being one of the sort of key areas for us. So Abby already touched on this, but we know that there's been growing concerns about children and young people's mental health. So I just sort of wanted to contextualize some of what I was going to say, just to really recognize that no child or young person in this country has an easy time navigating the mental health system. And sometimes even having the financial means doesn't mean you actually get the outcomes you want. So it's incredibly difficult for children and young people at this time. And there's a postcode lottery in provision. So depending on where you are, you might have access to great early help services, such as those delivered by Bernardo's in Birmingham and others. But that's not consistent across the country. So you can really imagine if you face inequalities and discrimination, how much more harder that navigating the system really is. So Abby touched a little bit on the rise in prevalence. Since 2017, it's gone up from 1 in 9 to 1 in 6 children and young people, based on data from NHS Digital. And there's all sorts of factors that may be influencing this increase in mental health need for children and young people. And there's still so much more research that is coming out to really speak to this. But from our perspective, we see through our work the sort of devastating impact austerity has had on child poverty, and knowing the links there between poverty and mental health. Social media and digital, the COVID-19 pandemic, and just the ways in which that has entrenched inequalities in our society are some of the factors that we see. When it comes to looking at data on the mental health needs of young people from racialized backgrounds, as Abby said, the data is quite poor and patchy. What the same prevalence study that NHS Digital produced tells us is that Black, Asian, and minority ethnic young people are those who are least likely to present with diagnosable levels of mental health concerns. From my perspective, and just sort of building on Abby's point there about interpreting maybe some of this with a bit of caution, is that perhaps maybe the tools that we use to screen the mental health of young people from racialized backgrounds may not be fit for purpose for whatever reason. They may not, accurately represent their mental health state. And again, as Abby said, it doesn't help us to better understand why is it as soon as these young people become young adults, they're overrepresented in acute mental health settings. For the first time, actually, and this was based on some unpublished data that was leaked via The Independent last year. It showed that Black children and Black mixed race young people made up 36% of those detained in mental health hospitals, but just 5% of those in community settings. So that's a very significant inequality, and clearly shows this group of children and young people are not getting that early and timely support. Again, some earlier research by Anna Freud Center in UCL showed that their pathways to support also tends to be through coercive means. So the young people from racialized backgrounds being twice as likely to access mental health care via court orders such as social care, or via the criminal justice system as well. So for us, I guess one of the messages that we continuously try and put out there, and Abby, again, you touched on this, is that race and ethnicity are not known risk factors for poor mental health. There isn't any research out there that shows that Black or racialized young people are genetically predisposed to developing mental health problems. So I really think we need to flip this on its head and frame their experiences of racism and discrimination as the risk factor. And just some of the ways that shows up in their lives is, for example, they're much more, Black children are much more likely to be growing up in poverty. I think just under half of Black children in England are growing up in poverty. So that's huge. Many of them related to the poverty point is living in housing insecurity, facing homelessness, and there was some research out about destitute children and families today that Joseph Rowntree Foundation put out. Again, Black young people are much more likely to be facing difficulties in schools. So, for example, thinking about the disproportionate school exclusion rates and how that sort of impacts their life chances in the longer term and their mental health. Much more likely to be living in unsafe neighborhoods. So really thinking about how this intersects with issues around serious youth violence and the trauma around that area. Immigration and unsettled status is another sort of key issue. And just thinking about the growing hostility of immigration policy in this country and how that in particular affects young people who might be separated or unaccompanied children as well. And then on top of all of these things, just the sort of daily experiences of racism and discrimination tends to wear down their resilience over the teenage years, and that impacting their mental health as they enter the period of adulthood. And so, yeah, so there is some research out there, and I will say that most of this tends to be based on literature based in the US, Canada, Australia, but the evidence base around this in the impact of racism in the UK is beginning to grow over the last decade or so. And we know that experiencing racism itself can have a profound and lasting negative impact on mental health. And it's been linked to a range of poor mental health outcomes, such as anxiety, depression, and sleep difficulties. And then this interesting fact at the bottom here came out of a big sort of meta-analysis of different studies, which suggests that racism is twice as likely to impact mental health than it is physical health. And I thought that was quite interesting. So because of all of these factors, there's really a growing concern for us to deepen our understanding of racism and begin to see it as a form of trauma. Many of you may also be familiar with adverse childhood experiences as well. So there's growing concern, cause to kind of think about racism as part of that framework there too. And earlier this month, we actually published a paper looking at the effect of intergenerational experiences of racism on families and their mental health, which I can share a link to a bit later. And I also wanted to point people to a psychologist called Ghislaine Kinawani. I'll pop a link in about her work there as well. But she published a book in 2021, I think it was, called Living While Black, which looks at experiences of racial trauma in the UK and how that impacts people from childhood up to the sort of later years in life, which is quite interesting and neatly sort of summarizes all the research in this area. So I just wanted to point to a couple of practical programs that we've been involved in. So Shifting the Dial was a 3-year partnership that was underway in Birmingham, and it focused on young Black men's mental health aged 16 to 25. And really, this was about addressing the overrepresentation of young Black men in acute mental health wards and shifting the dial towards prevention. So some of the partner organizations there, First Class Foundation, put together a program called Dear Youngers, where young Black men were offered sort of mentoring, coaching opportunities. They facilitated conversations around mental health, and there was a lot of sort of peer support embedded within the work they did. Light Post Theatre, which is based in Birmingham Repertory Theatre, created a dedicated theatre group for young Black men to explore themes around mental health through theatre. And actually they put on a number of very fascinating productions over the years, looking at Black men's experiences in various settings. And then Birmingham and Solihull Trust was involved in terms of thinking about creating an employment pathway for young Black men so they can better see themselves reflected within the mental health workforce. And I just wanted to share a clip of a brief interview. One of the young men involved in the program during the pandemic, and he was just sharing a bit of his thoughts and experiences on the issue. So I'll just play that and hopefully you can hear it.
In Wolverhampton, 3 members of the Dear Youngers programme spoke to me about being young black and male in the age of coronavirus.
The culture of masculinity is that we don't share, we have to bottle stuff in. Now, as a black man, it's compounded by the idea of racism as well. So, for example, if we go through like the mental health institutions, oftentimes the way that we come in or experience the mental health organizations is through hostility, through the criminal justice system. It's not easy to talk about racism and microaggressions in a white space. Sometimes things that we experience, there's no one really to turn to. When I would try and be vulnerable and share, it was kind of like it felt like I was being handled and dismissed. My experience was being dismissed.
Yeah, so there's a link I will share if anyone wants to see the full interview, but Amano, they're just really talking about hitting home around some of the discriminatory ways in which mental health services tend to respond to young black men. And obviously that kind of fuels mistrust, it fuels stigma as well. And, just kind of breaks down their trust in services. So that's something, that urgently needs to be changed. But I'm glad that in some of the discussions so far, people have alluded to issues around the lack of co-production, and also policy stagnation is something that came out. So this program that I just briefly wanted to share a little bit about is called Young Changemakers, and we've been running it with UK Youth and Diana Award. It's a national program, and there's some young people from Birmingham involved in this as well. But we really kind of wanted to think about ways of centering Black young people in the reimagining of mental health services and support from their perspective. So we came together with our various sort of different areas of expertise, and this is a 3-year program, and we're running lots of sort of mini projects that sit underneath it. So just to touch briefly again here, we're looking at ways of shaping policy change. We know we've got a general election coming up in the next year or so. So we're working quite hard to get tackling racial inequalities and in mental health on the agenda there. Lots of work being done across the program to train practitioners, especially within the youth sector and the voluntary and community sector. Various projects as well are looking at tackling public attitudes towards Black young people and their mental health as well. And a key part of this work as well is to build a network of peer support for young people and also strengthen the research and evidence base. So I just want to share an example of one of the social action projects we've been supporting that the young people have come up with. And if it was left to us as like mental health organizations, we may not have considered this issue as, as highly as the young people did in a way, but they said for them, one of the biggest drivers for poor mental health for young Black people was the everyday experiences of racism and microaggressions within the education system. So this group of young people called Not So Micro came up with a campaign to introduce microaggression training and anti-racism training within teacher training, so that teachers are better equipped at spotting the signs of racism within schools and being able to respond to it. So, they've been doing all sorts of things like parliamentary petitions and meeting with teaching unions across the countries and so forth. So we hope that this is something that will be taken forward by a future Department for Education. And yeah, I mentioned it's also really important for us to better center young people within the research itself, so it's more relevant to them. And I'll share a link to this briefing that was co-produced with young people, looking at basically they did their own sort of analysis of the research that's out there on young Black people's mental health, thinking about issues around stigma, for example, access and outcomes as well. So I'll share that with you all, but I will finish there and happy to kind of take any questions as well. Thank you.
That's brilliant. Thank you. And yeah, like Katja says, open the floor to questions if anyone's got any before we finish up. Yes. Go ahead, Jo.
Thanks very much for a really interesting and thought-provoking webinar. That's been really useful. So I'm working with Abby as well in Birmingham, and just wondering if you know, just kind of putting it out there really. If there's anything that you feel you could or we could support more in Birmingham, if you need more engagement or anything, if there's anything that we can do to support those programs, then by all means, please just let us know, and we'll absolutely look for all the avenues that we can to support that.
Oh, that's brilliant. Thank you. Yeah, we'll definitely take you up on that offer. And actually, there are some examples of councils, you know, making pledges towards becoming anti-racist themselves and thinking about ways that they can kind of encourage school settings within their area. So yeah, would love to kind of follow up with you. And Melvin is actually based in Birmingham as well, so maybe he could come and present to a group of you or something.
That'd be amazing. We've
Yeah.
also got a project called Black Here as well, where we've got carrying out a lot of actions from that report. And I'm not sure if you're aware of that. If not, we can share that with you. But yeah, so we've certainly got a place for that to sit. So that's fabulous. Thank you.
Brilliant. Thank you. Thanks.
And Kadra, we're also in the process of developing a research project as well with schools, which is going to be starting probably not till next year. So it would be great to discuss that further with you, because we're wanting to have a platform that enables schools to have resources on different matter, and the focus is going to be on mental well-being and resilience of young children and young people, because as we recognised coming out of COVID, that's the concern that many schools have about their students.
No, absolutely. I'll pop my details in the chat so we can follow up about that. But I did actually forget to mention that the young people have developed a training program for schools, so maybe that's something they can share
that would
with
be
you.
great. So
Yeah.
if you develop the platform, we can make sure that that's then shared widely across the city.
Amazing. Thank you. Thanks, Marion.
Brilliant. I don't think anyone else has got any other questions, and no more raised hands. So I think, well, Kadra's already put her email address in. I will put mine in as well, and then all the links for what's been discussed today. Lewis will just put in a survey link if everyone would be happy to fill that out. That would just be great for feedback about future presentations, about going forward. Is there anything else from you, Kadra, before we wrap up?
No, just that I'll share the links and the slide pack with you as well, so you can share it. Thank you.
Lovely. Yeah, we'll share all the slides and all of the links. Thank you all for coming today, and enjoy the rest of your afternoon. Thanks. Bye. Thank you.
Thank you.
Thank you. Bye.
Oh.